So, welcome everyone to MDEH Clinical Anatomy class. So, we are studying clinical anatomy. Yesterday, we discussed about AVN, avascular necrosis. So, that is related to hip joint. Okay. So, today we are going to talk about knee joint, the main clinical condition which you see in your clinics, that is knee osteoarthritis. So, knee osteoarthritis is the most common condition you see in your clinic. Okay, most of the person nowadays are suffering from knee osteoarthritis. Okay, so let's see what is knee osteoarthritis, what is the reason behind, and what are the causes. How do you examine in your clinic, and how many types of knee osteoarthritis are there? So let's discuss one by one. So basically, what is knee osteoarthritis? So you can see this is the normal joint. This is femur bone. This is tibia bone. So you can see this is the normal cartilage. Okay. So the cartilage is surrounded to the bone. Okay. So what happened? The cartilage degeneration happened. Okay. There are the multiple reasons. Synovial fluid decreased or any damage to the membrane, synovial membrane. Okay. Or direct cartilage is affected. Okay. So it may be multiple reasons. So what will happen? Because why knee is affected? Can anyone answer this question? Why knee is affected? Most of the here shoulder joint you have, hip joint you have, they will occurs, but not as much as knee joint occurs. Okay. Can anyone answer why the knee osteoarthritis is most common than other joints? Other joints also synovial joints like shoulder joint, elbow joint, and we have hip joint. Why only knee joint?
More pressure coming.
Continue, wait.
Yeah, good answer. So continuous, because these joints are weight bearing joints. Knee joint is weight bearing joint. So that's the reason knee joint is mostly affected. Weight bearing joint. Okay. So knee joint is a weight bearing joint. So that's the reason whoever have basic obesity, so he will definitely develop knee osteoarthritis. Okay. So other than that, other reasons also. So wearing of cartilage is known as knee osteoarthritis. So here degeneration will happen. Degeneration will happen. So I tell here one important thing related diseases. So if you observe, some diseases are acute. Okay, because it is related to electrohomeopathy. So here very very important. Acute. Some diseases are subacute. Some diseases are chronic. And acute diseases in electrohomeopathy, what we will call? We will call positive disease. Subacute, neutral disease. Chronic disease are negative disease. In chronic disease, if you go, there are list of diseases. One is degenerative diseases. Degenerative diseases. Organ failure. And nowadays, most common diseases are seen like genetic diseases. So they are the form of chronic diseases. Okay. So in knee osteoarthritis, it is degenerative disease. It is degenerative disease. Okay. It is degenerative disease. Can anyone tell me that what meant by degeneration? What it meant by degeneration?
Fluids and cartilage
Sorry.
coming neck.
You can chat. You can answer in chat box also. No issues. If it is difficult to answer. Hmm? What is meant by degeneration? So basically, if you observe the cell have three things. Okay. One is cell membrane. Okay. Another one is cytoplasm. And here is nucleus. Here is nucleus. In the cytoplasm, you have organelles. Organelles. So what meant by degeneration? Degeneration is nothing but breakdown of cell membrane. Breakdown of cell membrane. What is meant by organ failure? Organ failure?
Particular organ not properly working or
Yes, yes.
damaged.
Yes, it's okay. But scientific answer. This is degenerative. Okay. Degeneration happens. Okay, but scientifically, what happened? Cell membrane is damaged. Means in the articular cartilage. Okay, articular cartilage, cell membrane is damaged. So that's the reason. What type of cell are present in cartilage? Hmm? What type of cell are present? Today I am doing questions. So don't worry. If you know, please answer is. Hmm? Can anyone? So as a doctor, we have to know everything. Okay. So basically, articular cartilage is made up of chondrocytes. What type of cells? They have chondrocytes. So what happened? Chondrocytes cell membrane is damaged. Okay, that's the reason we are calling degenerative disease. That's the reason we are calling degenerative disease. If the cell nucleus is damaged, okay, nucleus is damaged. So what we will call? We will call organ failure. Means the information from the cell, it is coming from the nucleus. It is not coming. So what happened? Whole cell will not work. So the function of the nephron is to filter. So if the nucleus is damaged, it is unable to do filtration. Okay, it is irreversible. It is irreversible. So that is the reason nucleus damage or DNA damage, these are irreversible. Membrane damage, sometimes it's reversible, sometimes it's also irreversible. So there's the reason doctors or allopathic doctor call whatever whoever have chronic kidney failure or kidney failure, they will tell that it is irreversible. So gradually his kidney will go to the failure side. Okay. So this is other topic, but here I want to explain that there are the diseases are types, three types: acute, subacute, and chronic. In the chronic, you have degenerative disease, organ failure disease, genetic disease. Nowadays, genetic diseases are most common. Okay. So let's come to the topic. So osteoarthritis, I think you understood that why it is called degenerative disease. Okay. In the cartilage, you have chondrocytes. That chondrocytes cell membrane is damaged. So there's the reason we are calling degenerative disease. Okay. So it is divided into two parts, primary and secondary. Okay. First, it start with primary only. In that, you will get articular degeneration initially, first stage. But there is no any symptom or any cause, without any cause. Okay. Primary osteoarthritis is that without any reason, degeneration of articular cartilage is happening without any symptom, basic symptoms. In the secondary osteoarthritis, there is a reason behind that. Okay. Any trauma, any rheumatoid arthritis, like autoimmune disorders, or any cause is there. So we will call secondary arthritis. Along with that, you will develop symptoms also, but it is very painful and it is chronic joint disorder. Okay, it will not only affect the knees, but also wherever you have synovial joint, it will affect. Okay, so what are the symptoms? Okay. Knee pain, sometimes regular knee pain, sometimes intermittent knee pain. Okay. When you do some work, gradually the pain increases. By activity, the pain increases. Okay. And there is a stiffness in the knee. Okay. And sometimes swelling in the knee, and below, from the knee to the ankle joint, till the ankle joint, you will absorb the swelling. You can get the edema also sometimes. Okay. And sometimes joint cracking sound. Cracking sound is also you will able to hear in the knee joint. And sometimes knee locking, knee locked happen and it is unable to fold. Patient have painful stiffness in that condition. Okay, so these are the difficult symptoms. And sometimes difficulty in walking, and those patients are unable to climb the stairs, and they are unable to do household works also. Okay, so what will give their treatment or improvement? Sometimes medicines along with uh, physiotherapy, exercise will improve the mobility. Okay, so let's see what are the causes. What are the causes? The most common cause is old age. Okay, every person will develop degenerative diseases after a certain age. It is a truth. Okay, we cannot ignore that. But what will happen if you take remedies, if you make precautions, you can delay that process. So if a person is getting the knee osteoarthritis at the age of 45, so he started exercise, he started diet, he is doing everything related to improve his condition. But what will happen? The age will increase, but the condition is not affect to him. After 10 years, 55, 60, at that age, he will get affected. So definitely everyone will get this problem. But important is that how early he's getting. Okay. How early? Important is that how delay is getting. Okay. How delay is getting. So certain age is degenerative stage. So in electrohomeopathy also, we have degenerative diseases. Okay. So we will give the remedies to delay the process or improve the condition of the patient. Okay. So overall, 6% of adult is affected, and mostly women are affected. Uh, Mostly 30% are women and 10% of men. 60 years after 60 years, they will get osteoarthritis. 70 years percent, 40% high risk of chances they are getting osteoarthritis, and they will have uh, a life expectancy problem, and they have obesity rises. These are the conditions that will affect the osteoarthritis. Okay. So what are the causes? I told you primary, there is no cause, there is no reason. The osteoarthritis occurs itself. Okay. And secondary cause, obesity is leading for the cause of osteoarthritis. And there is no movement, always sitting in one position or always standing. This also lead to the osteoarthritis. Okay, posture, injury, defect, congenital defect, by birth defect, or loss of mobility, family history, rickets. Okay, osteoarthritis, osteomalacia. Rickets also got osteomalacia. Near absorption of calcium is decreased due to the deficiency of vitamin D. Rickets, infectious arthritis, psoriatic arthritis, diabetic also second main cause of osteoarthritis. Sickle cell disease, gout. These are the major common causes of osteoarthritis. Okay, osteoarthritis. And avascular necrosis also. It may be occurs in knee joint also. Avascular necrosis. The decrease the uh, blood supply to the knee joint. Okay, we will discuss this. Risk factor. Risk factor is, so patient is unable to move, patient is unable to do his daily activities. Okay, so he will dependent. He will dependent. Okay, will get muscle weakness, and sometimes he can fell down. So due to that, he will get injury to the head, neck, or back, lumbar region. Okay. So now come to the part of anatomy, how the knee joint looks like. This is the femur bone. Okay. This is the femur bone. This is tibial bone. This is fibula bone. You can see this is the articular cartilage. This is the articular cartilage. Okay. And you have ligaments and tendons are there. Quadricep tendon. This is patella bone. Okay. This is patella bone and patellar ligament. And meniscus also is there. So we prevent the friction. These are the meniscus, lateral meniscus, medial meniscus. Okay. And you can see the ligaments. This is the ACL ligament. Most of the person having ACL tear. So what is this ligament is holding like this. These are the ligaments. Okay. Cross by cross. They are holding the knee joint like this. So ACL, anterior cruciate ligament, and you have posterior cruciate ligament. Okay, these are the ligaments. And you can see the knee joint. Another image. Yeah, it is very important. This is the femur bone. This is tibia bone. This is the articular capsule, synovial membrane. This is articular cartilage. This is articular cartilage, and you have this synovial fluid. This is synovial fluid. So what happens? Synovial fluid is decreased after that due to the increase in weight. So gradually the articular cartilage degeneration happens. Okay, you can say this is the normal knee. This is osteoarthritis knee. So due to the pressure, due to the friction, the bone articular cartilage is reduced, lost. Okay. So how the patient come to your clinic? He has pain upon movement, stiffness, mostly early morning stiffness. And if you move, if you do flexion, extension, so whenever joint issue problem patient come to your clinic, you have to do 4 to 5 types of movement. You have to do extension, okay, flexion, फिर abduction, medial rotation, and lateral rotation. Okay, you have to do this examination. Okay, compulsory. So what happened when you do the examination, you will get an idea which area is affected, most affected. If you are doing inner side, medial side, lateral side, means that's had affected. Extension, flexion, extension, medial rotation, lateral rotation. So these are the movements you have to do definitely in your clinic. And they have also pain while standing and also sitting. Okay, prolonged standing, prolonged sitting also, they will get pain. Okay, and you have press, if you press them, palpate them, and palpitation is also very important. You have to press them. Okay, press that area, knee joint. You have to press that area. You will get, they will shout. If they have more pain, they will more shout. And if you have less pain, let's shout. And joint enlargement also, and means swelling is there. You can see this is the one image of osteoarthritis. This is one image of osteoarthritis. So here you can see space is reduced. Here space is normal. Here is also space is normal. Here also space is normal. Here space is reduced. So what will happen? This bone and this bone, what will happen? Friction will happen. Friction will happen. Okay. Then what will happen? Pain will occur to the patient. Difficulty in walking, difficulty in sitting, everything will there. So how do you diagnose? Okay, here they are the stages of knee osteoarthritis. You can see this image. This image, okay. You can see grade 0, grade 1, grade 2, grade 3, grade 4. Grade 1, no issues. You can see how healthy joint is this. Grade 1 starting, early degeneration is started. You can see how this image is looking, how this image is looking. So if you scan like 25 to 35 years male patient, you will get that type of scan. After 45 years, early degeneration will start. This is first. Then you can see this is how this is looking from this. You can see this is the early degeneration and the space is reduced. Osteophytes also started, means bones spruce. Okay. And you can see this, how this is looking. Even more problem than that. Okay. Even more space is reduced. Okay. And multiple osteophytes, sclerosis, and bone deformities. You can see how healthy, some healthy bone is that, but here you can see, here you can see the, this is curvature. Okay, you can see this is curvature, very good curvature. Here also there, here some reduced, here most reduced, here lost. The curvature is lost. You can see. Okay, this is, it is flat like this, but here you can see something is there, something here is there, something here also there, here also more available like this, but here flat, flat. You can see flat means the bone is getting uh bone also getting degenerated, and it is also rubbed with another bone or friction with another bone, and they attach to each other. Okay, they doesn't have any single or 1 mm gap. They touch each other and they are rubbing each other, friction is there. Okay, so you can see flat, flat. So this is fourth grade. In that stage, doctor will advise for surely surgery. Okay, surgery means joint replacement. So we'll discuss what type of treatment are there. So everything is written. You can see in this image also. Okay. What type of examination you will do? You will advise basic X-ray. Okay. How the cartilage is affected, how the basic gap is there. Okay. Between two joints. Okay. And osteophyte and curvature. What I told you, you have to examine that. And sometimes arthroscopy also done, means a needle, so a needle will insert and the sample will taken of the fluid which is present in the joint, synovial fluid. Then it is examined, because in that fluid, if the cartilage material is there, means cartilage degeneration is happening or any infection is there, they will check upon that. Arthroscopy, by inserting a camera, they will see the whole structure. Okay. MRI. MRI is very MRI is the best scan which you complete idea about the osteoarthritis, knee osteoarthritis. Okay, what will you find? Space. I told you space. Okay, osteophyte, bone spruce, bone parts, sclerosis, dead tissue, or cyst, means the dead tissue is combined with the synovial fluid, and you will get a cyst like substance. Okay, joint space narrowing. Okay, joint space completely disappear in last stage, fourth, third stage. Okay, now come to the treatment part. Okay, what type of treatment you have to give? Mostly in modern medicine, they will start with physiotherapy and painkillers, non-steroid anti-inflammatory drugs, and supplements. Okay, physiotherapy is something will help for the movements, because you are strengthening your muscles. Okay, muscles, like another thing, knee brace also advised for the patient who are in first or second stage with physiotherapy and along with medication. Okay, knee brace and exercise and advise painkillers or supplements, injections. Okay, in allopathy they will advise corticosteroid injections which will reduce the pain for some duration, or else in the synovial fluid there is an acid. Okay, in anatomy class I told that this acid name is hyaluronic acid, hyaluronic acid or hyaluronic acid. So this is injected artificially, this is injected. What will happen? The gap between the knee is increased, means it is a therapy. Okay, so it is also nowadays using. Okay, knee injections, that is very costly, maybe 30 to 40,000, maybe something Corticosteroid injections, it is also taken. And another treatment also is there, PRP. Okay. Did you hear about PRP? Anyone? Plasma rich protein. By taking this person sample from the plasma, they are taking and they are injecting to the knee joint. So there is also chances of improving the uh, cartilage. Okay. So these are the treatment available in modern medicine. If it is not work, if improvement is not there, then last stage is knee replacement. Okay. So there are other reasons also. Knee osteoarthritis occurs, meniscus injury also. You will have pain in the knee. Patella femoral bone issues also there. Gout issues all there. Rheumatoid arthritis. Due to that reason also, you will get knee pain, septic arthritis, hip osteoarthritis, lower back pain, or I told you, uh, ligament injury, anterior and posterior. So now examination part, it is very important. When a patient come to your clinic, you have to examine all those things. Okay, morning stiffness, you have to ask pain, pain while sitting, pain after work increased, mobility reduced, weight. You have person weight obese, he will get the pain. Definitely, the pain is increases. Okay, sleep may also affected because of the pain. Okay, other things what you have to observe, any swelling is there, any redness is there, okay, or person is doing rest or not, okay, he's having always working, so you have to advise to the patient. Gain how is walking, sometimes walk like this, they have to work load, you have to give load on the joint, so due to the load also they are getting the pain, so you have to improve the mobility. Palpitation, you have to check, press and everything. And how is, and movement, I told you, strength. Okay. And you have to check the strength, muscle strength, and how they are walking on the climbs, walking excess walking and climbing on the streets. This is also one of the reason you have to examine that, and balance, how they are balanced well, the pain is there. Okay, so they have to check everything related these things. And already I told you, physiotherapy exercise is very important. And along with, you have to reduce the weight, advise the patient to reduce the weight. There are different types of exercises I written, you can follow this. Yoga, tai chi are examples, but according to physiotherapy, you have to follow the exercises. Okay, and other therapies also there, like hydrotherapy, it is also very helpful. Okay, to reduce the pain. And taping, okay, it is also helpful. Massage, this is also helpful, but it is not cure. Okay, bracing, I already tell. In physiotherapy, they will do tense therapy, dry needling. Okay, toe out gait modification, walking style improving, therapeutic ultrasound, laser therapy, and hijama cupping therapy. So this will give symptomatic improvement, or sometime some relief to the patient when you do this all type of therapies. But in my opinion, hijama cupping therapy is very best, because it will remove all the debris or all the dead tissues from that area. There are the chances of increasing blood circulation and improvement of articular cartilage. Okay, this is all about the osteoarthritis and EH management. Now, how do you manage? Because reason behind osteoarthritis you have to know. Okay, so basic treatment here: S6L1B, C6C4N1G, okay, and S6C6YE, S10C10WE, C3A3B. So for the cartilage, C3 is the best remedy. C3 remedy for cartilage. Okay, C3 will improve the cartilage degeneration. So C group is always for degenerative remedies. You have to select C3. C3 is the best. Okay. And application is very important in electrohomeopathy. Always remember that you have to advise application to the every patient. but after 15 days. Okay, initially you have to give oral remedies. After 15 days, if you have severe complaints, severe pain, you have to start from first day itself. Okay, this is the very important thing. If a patient comes to your clinic, a moderate condition like subacute condition, not severe chronic condition, so you have to start application remedies after 15 days. Okay, and you have to continue, and you have to give in D3 direct spigeric essence. Okay, you have doesn't dilute that, because he need positive energy. Okay, positive energy, but it is maybe a negative remedy or positive remedy. So if it is right side, apply C3RE, left side C3Y, medial side. So most of the person having medial side pain, lateral side doesn't have pain, because the weight is coming from the top to bottom is on medial side. So there's the reason patient develop medial side pain. Okay, medial side pain. Okay, other remedies according to condition. You have to do pulse diagnosis, tongue diagnosis, iris diagnosis, and you have to check which part of the organ is affected in the patient. Okay, lymph organ is affected, blood organ is affected, lymph producing organ is affected, lymph utilizing organs is affected, lymph uh, purifying organ is affected. Same again, blood production organ is affected, blood utilizing organ is affected, blood purifying organ is affected. So according to that, you have to treat. So for that, you have to check the pulse. Always check the pulse of the patient, check the tongue of the patient, and check iris of the patient. Then you will get the cause of the degeneration of the knee. Okay, along with, you have to treat that also. So you have to follow, whenever you are treating, you have to follow anatomically, physiologically, pathologically, and biochemical, and as well as electrohomeopathy. By this, you will get results, good results. Okay. So thank you. This is all about knee osteoarthritis. I hope you understood about that. If any doubts, kindly ask.